Hi everyone, in today's video we are going to talk about the anatomy of the breast. So the breast is a complex organ with significant anatomical, physiological and clinical importance. Primarily associated with lactation in females, the breast is also a secondary sexual characteristics that plays a role in social and reproductive functions. While both males and females possess breast tissue, its development and function differs significantly due to hormonal influences. So, understanding the anatomy of the breast is essential for medical professionals, particularly those in the fields of oncology, surgery, and radiology, as conditions such as breast cancer and mastitis are common health concerns. So this video explores the details of the anatomy of the breast, including the structure, function, blood supply, lymphatic drainage, and clinical significance. So that being said, please you can go ahead to like this video, or you can also subscribe for more videos like this. So let's continue. The gross anatomy of the breast. The breast is also known as the mammary gland. It is located on the anterior chest wall, overlaying the pectoralis major muscle. It extends from the second to the sixth rib vertically, and from the sternum to the mid-axillary line horizontally. Structurally, the breast comprises glandular tissue, adipose tissue, connective tissue, and a complex vascular and lymphatic system. Now let's talk about the glandular tissue. The glandular tissue of the breast is responsible for milk production and secretion. It consists of 15 to 20 lobes arranged in radial patterns around the nipple. Each lobe is further divided into smaller lobules, which contains alveoli, the milk-producing units of the breast. Now the alveoli is lined with epithelial cells that secrete milk and myoepithelial cells that contract to expel milk into the duct. Now, those lobules drains into the lactiferous ducts, which converge towards the nipple. So each lactiferous duct has an enlargement called the lactiferous sinus. It serves as a temporal site for storage site for milk before it exits through the nipple. So this can actually be an exam question. The question might go like this: which part of the breast is responsible for temporal storage of milk before it exits the nipple? And the answer should be the lactiferous sinus. Now let's talk about the connective and the adipose tissue of the breast. The breast is supported by a network of connective tissue known as the Cooper's ligaments. It provides structural integrity and maintains the shape of the breast. This ligament extends from the dermis of the skin to the deep facial overlaying of the pectoral muscles. Adipose tissue surrounds the glandular components of the breast, giving it the size and its contour. Now, the amount of adipose tissue varies among individuals, and it is influenced by factors such as genetics, age, and hormonal status. So you can actually say the size of the breast can be influenced or is influenced by genetics, age, and hormonal status. Now let's talk about the nipple and the areola of the breast. The nipple is a highly vascularized and innervated structure at the center of the breast. It contains the opening of the lactiferous ducts through which milk is secreted during lactation. The surrounding pigmented area, known as the areola, contains specialized sebaceous glands called Montgomery gland. This gland secretes an oily substance that lubricates and protects the nipple during breastfeeding. The areolar pigment may darken during pregnancy, and this is due to hormonal changes. Now let's talk about blood supply and innervation. The breast receives an extensive blood supply primarily from branches of the internal carotid artery, also known as the internal mammary artery, the lateral thoracic artery, and the posterior intercostal arteries. Venous drainage follows a similar pattern, with blood returning to the heart through the internal thoracic and the axillary veins. So take notes of the arteries and the veins. This might come out in your exams. So let's talk about the innervation of the breast. So the innervation of the breast is provided by the intercostal nerves, which are the T1 to T6, and they supply sensory and autonomic fibers. The T4 dermatomes is particularly significant as it corresponds to the level of the nipple in most individuals. Sensory nerves in the breast plays an essential role in reflex responses such as milk ejection reflex during breastfeeding. Now let's move over to the lymphatic drainage of the breast. So the lymphatic drainage of the breast is actually crucial to immune function, and it also plays a significant role in the spread of cancer. Lymph from the breast drains into three major regions. The axillary lymph node, which is the majority, about 75% of the lymph from the breast drains into the axillary lymph node located at the armpits. Now these nodes are subdivided into 5 groups: the pectoral, which is the anterior nodes, the subscapularis, which is the posterior nodes, the humeral, which is the lateral nodes, the central nodes, and the apical node. Then the second node is the internal mammary lymph node, which is also called the parasternal node. Now these nodes are located near the sternum, and it receives lymph from the medial aspect of the breast. They are important in cases where cancer spreads centrally. Then number 3 is the supraclavicular and the infraclavicular lymph nodes. These nodes receive lymph from both the axillary and the internal mammary nodes, and it serves as a potential site for metastasis. So the lymphatic drainage pattern is clinically significant because breast cancers can spread through these channels, leading to regional or distinct metastasis. Now let's talk about hormonal influence on the breast. So the development and the function of the breast are actually regulated by various hormones. For example, estrogen, which stimulates the growth of the ducts and fat deposition during puberty and pregnancy. So if you want to hold any hormone responsible for the size of your breast, then you have to hold the estrogen because it is responsible for fat deposition. Then number 2 is progesterone, and this helps to promote the development of lobates and alveoli in preparation for lactation. Then another hormone is the prolactin, which is secreted at the anterior pituitary gland, and prolactin is essential for milk production during lactation. Another hormone is oxytocin. Oxytocin released by the posterior pituitary gland. Oxytocin stimulates the contraction of the myoepithelial cells, leading to milk ejection. So as you can see, the progesterone, prolactin, and oxytocin are actually all fixated on lactation. So hormonal fluctuations during menstrual cycle, pregnancy, and menopause significantly impact breast tissue, influencing its size, density, and actually its sensitivity. Now let's talk about the clinical significance of breast anatomy. Number 1 is breast cancer. So breast cancer is one of the most common cancers worldwide, affecting millions of women annually. It arises from the abnormal growths in the ducts or the lobes of the breast. So early detection through self-examinations, mammography, biopsy is crucial for effective treatment. So the pattern of the lymphatic drainage influences cancer spread, making the axillary lymph node assessment essential in staging and treatment planning.